Hi, so today we're going to speak about Invisalign. So I'm just going to share with you some of the FAQs that I get asked all the time, and maybe it can give you some insight into some of the simple things with regards to Invisalign. So one thing we get asked all the time, is Invisalign better than traditional braces? Now that's a very subjective question, can't really answer it, whether one is better than the other. It depends on each individual case, and it depends on the tooth movements necessary, etc., etc. So what I would say is Invisalign, the process of moving teeth is different to a fixed brace. I would say majority of the cases that are not complicated, i.e. they don't need extractions, can be done with Invisalign. Obviously extraction cases, in my opinion, is better served with traditional braces. But there are cases where Invisalign is useful for extraction cases. I personally prefer to use Invisalign for non-extraction cases. That's just a personal preference. The other question we ask is Invisalign painful? So no, it's not painful. When you first have them, it's obviously a little uncomfortable, but once the teeth start to move, it's not really painful at all. So with all the cases that we do, very rarely someone complains of the pain, compared to fixed braces where it can be considerably tender and painful when you're changing the wires. The other question, can both adults and children have Invisalign? Yes, absolutely. It works well on both adults and children. We offer it for both. Probably do a lot more adults than children, in all honesty. Because compliance becomes an issue, especially given that you can remove it. So, yeah. How long does it take for Invisalign to straighten your teeth? Again, very subjective, depends on the state of the teeth, malocclusion, what exactly you're trying to achieve. But typically, I would say, for us, I would say the average case is probably 4 to 6 months. Generally speaking, not more than a year. Is it possible to switch from braces to Invisalign? Yes, it is, absolutely. In fact, sometimes what we do is we do a combination treatment where we start off with fixed braces if there's, like, say, a tooth that's really, really weird position, like it's either really far forward or back. So if you put traditional braces on that, it will move that tooth very quickly. Within 4 to 6 weeks, it can be completely in its position, in which case you can switch to Invisalign just to do the final corrections. So that's something we do sometimes do, and it works very, very well. How do I clean Invisalign? Everything comes with the Invisalign packaging. There's various retainer. Bright is something that can be used to leave it in for a little while, and just generally cleaning it as per the instructions that they send you. So why do patients come to us? Well, various reasons. One of the big things is that we are a diamond provider, so we do a lot of Invisalign. But the other thing is that for a lot of my cases, Invisalign is just the start of a patient journey. So we use Invisalign just to get the teeth in the correct alignment before carrying out more advanced restorative work. So for instance, a lot of patients come to myself for veneers, and my kind of speciality is non-prep veneers. So we don't cut the teeth. The only way you can really do that is if the teeth are in a really good alignment, because if they're not in a good alignment, then you have to have orthodontics. Ideally, Invisalign is ideal for this, to get them in the right position before you are able to do the veneers. So that's something that people don't realize, but when they come and see me, that's what I look at. And it's a big part of my workflow, doing Invisalign or even fixed brace before we go ahead and do ceramic work, because like I said, I don't like to cut the teeth. I'll show you what Invisalign looks like, just in case you don't know. So these are models and this is the actual Invisalign retainer. You have these what we call attachments onto the teeth. This allows certain tooth movements by the aligner actually grabbing hold of the tooth, and it's able to then move it in a direction that's necessary for the treatment. So this is a part of the Invisalign process, having attachments, and it's useful. Now, a lot of people ask which one's more suitable. The only way you can really answer that is by having a consultation, because like I said, each individual case is different, and Invisalign may be suitable for certain cases and others, fixed braces is more suitable. The other thing where Invisalign is really useful is if you've got veneers or crowns and you want those have moved and you want to push them into a better alignment, then Invisalign is very good for that, because with fixed braces you have to attach a bracket to those teeth, and if it's a ceramic crown or veneer, it's quite difficult to do that. And secondly, you can also ruin the surface of that crown or veneer. So Invisalign for that is actually super useful and highly recommended if you're trying to move teeth which have got ceramics or crowns on them. But yeah, so that's how they look. This is the bottom one. It's just a clear aligner, and they come in packaging like this, and you just change them every week. Very good system, works really well. How does this vary to the online providers for aligners, such as your Smile Direct? Well, simple difference is that this is being carried out by a dental professional. So each step of the way you're having advice and being given all the correct options, as well as diagnostic tools.